Oh, welcome. Come on in, make yourselves comfortable. It's good to see you this morning. We have a very helpful program. We hope that you get a lot out of it today. As you're arriving, feel free to write in the chat where you're joining us from and what brings you here today. What made you decide to come to this particular program? Because this is one that I think is important for everybody. And we'd love to know what made you decide to use this hour to spend it with us hearing about the topic of medical billing. And I'll introduce myself. I'm Miriam Diamond. I'm the program director for the Encore Boston Network. We help people age 50 and over make a difference and have more fulfilling lives through work and service and social action. And you can learn more about us where you signed up, encorebostonnetwork.org. And we're getting some replies here. People want to learn about the No Surprise Act. That will be very important to find out about. We have people, so let us know again where you're joining us from and what made you decide to come here and spend your morning with us. So this event is being recorded, just want to let you know. And we will, so you don't have to jot everything down. And if you miss something, you'll have a chance to hear it again. We'll send you the link and we'll send you a follow-up email with resources, if there are any resources you want to know about. If you find closed captioning helpful, please turn that on and respond throughout the program. You can use the chat, you can add comments, you can react, you can submit questions. We encourage you to write the word question before you ask a question so that it stands out. We will have a Q&A section at the end, but if something comes up along the way, always feel free to add it. And again, I want to welcome you all. Our topic today is strategies for dealing with costly and or unexpected medical bills. And so our goal is to help you gain strategies for understanding and dealing with medical billing, including what you can do before and after treatment, what you can do when the estimates of benefits from the insurance companies and the actual bills arrive, and how you can address both the practical and the emotional aspects of this process, because it can be quite emotional. Today's presentation will be interactive, and our expert today is Catherine Cook, staff attorney and Justice Catalyst Fellow on the Access to Care and Coverage Practice Team at Health Law Advocates. And we will send you a link to all that and also ways to get in touch with her afterwards. She has served as Chief Operating Officer at Casa de Salud, which is a St. Louis-based health access organization. Catherine has a law degree from St. Louis University and a master's degree from social work from Washington University in St. Louis. So I now turn things over to Catherine. Welcome, Catherine. Thank you for joining us today.
Thank you so much, Miriam, and thank you everyone for joining today. I'm really excited to share some information with you and hopefully get the word out about how folks can deal with medical bills before it becomes too much of an overwhelming situation. Also want to thank Kendra for technical support, and you can go ahead and get my slides up, please. So as Miriam mentioned, my name is Catherine Cook, and I am a staff attorney with Health Law Advocates. Go ahead and advance it to the next slide, please. So as Miriam mentioned, today I am planning to give you a brief overview about HLA, Health Law Advocates, and my work there. I want to talk a little bit about medical debt generally, and then I will talk through some strategies you can use to potentially avoid medical debt, and then the strategies you would want to use after you're faced with medical bills. As you might expect, the strategies I'm going to talk about are general, they're provided for informational purposes, and they might not fit every situation. My hope is that having a general idea about some ways to approach bills will help you when you're working with your healthcare providers or your insurance providers, but I would still encourage you to get more specific help if you have a certain situation you're dealing with. I also will talk about how HLA can help with medical debt in case anyone in the Massachusetts area is looking for legal help or tailored advice. And then last, we will have a question and answer session at the end, but please jump in before then in the chat if anything is unclear. I want to make sure that I address questions as they're coming in if they're going to affect folks' understanding of the rest of the presentation. Okay, we can move to the next slide, please. So Health Law Advocates is a public interest law firm. We serve people in Massachusetts who are facing barriers to healthcare, and that includes unaffordable bills. I'm going to talk mostly about medical bills and medical debt today, but I did want to touch on some of the other things that HLA is involved in. So we work with people that are facing population-specific barriers. So sometimes those are barriers faced by immigrants who might have different documentation statuses here in the United States, or we work with folks who are looking for gender affirming care. We also have programs that focus on changes across Massachusetts, like ensuring equity between mental health services and physical health services, making sure that our programs are covering both of those. And then we're currently doing a lot of work to prepare for the transition out of the COVID public health emergency, making sure that people don't get kicked off their coverage and lose some continuity there. We also have staff attorneys in the family resource centers across Massachusetts, and those people work with mostly youth and some children to ensure that they are getting supports for mental health needs in schools so that they can succeed and hopefully not get tracked out into an isolated or segregated program or into the criminal justice system. And then closest to my heart is the Medical Debt Project. So HLA has been working with people to resolve medical debt for many years. However, I am actually the first staff attorney who's dedicated to medical debt at HLA. So we're excited about having that increased capacity here, and we are hoping to use that to increase capacity through trainings like this and getting information out to folks who can deal with medical debt, since one person isn't enough. It is a widespread problem affecting a lot of people in this country, and soon I'm going to give you some numbers, details about how medical debt looks. And there's a lot of people that are working on policy changes. So I want to draw everyone's attention to the fact that the information I'm giving you can change at any time. We have the No Surprises Act, which came out, is pretty new, and there's a lot of interest in how medical debt affects credit reports and a lot of ongoing changes related to that. My work specifically looks at creating a systemic change to help people individually. So rather than a focus on those policy changes, we're looking at strategies that people can use today to deal with the bills that they have in their house for care they received. So I am hoping to learn a little bit more about who is here. I saw a few people have already put in the chat the reasons they're here, where they're coming from. I also want to get a sense of the group's experience with medical debt. So for the next few questions, if you could raise your hand or raise your little Zoom icon in response, that would be helpful. And I'm not sure if it's easy to take down the slides while we do this so we can see kind of whether or not people have had these experiences. So who has had an unexpected medical bill? Got a couple of people. I think someone in the chat said it. Yeah. It's I think a pretty common thing that folks have been experiencing over the years. What about, has anyone here ever successfully received a printout of what their care will cost? You know, you're getting ready to go to the doctor and you get just a printout. You're going to get these services. It's going to cost this much, and this is the day you're going to be billed. Has that ever happened to anyone here? Okay, I saw a hand raise. I was gonna ask that person to share, but maybe it was a leftover hand. Oh, dental, people have experienced that. Well, that's great. It is not very common, and I think the opaque nature of what people will need to pay is part of the problem we have with medical debt. Who here has called their insurance to dispute a medical bill? There's a few people. Oh, great. Excellent. So many times I am meeting with folks and they haven't done that, haven't even tried. And so I'll talk a little bit more about this later, but it's something that's always worth a shot. And then last question for now, who has felt anxiety checking or opening the mail after you or a family member has received care? Yeah, more hands. I sometimes just tell myself, all right, once a week, I've got to check it. All right, thank you so much. We can go back to the slides and move to the next one. So I've got a few questions for you. I'm hoping that we can answer the questions in the chat. There are letters for each of the answer choices. So as we're getting to that slide, despite 97.6% of people in Massachusetts being insured, what percentage do you think had trouble affording medical care? If you want to put A, B, C, or D in the chat.
I'm seeing a lot of D's.
Yeah.
Catherine.
Yes. Perhaps not a very tricky question. The answer is D, 40%. So having come from St. Louis, there's a perception that I've heard both here and there that medical debt isn't maybe too large of a concern here in Massachusetts because coverage is so across the board. And that should be true. However, it's not the case. And actually, the rates at which people report their medical care is unaffordable is similar here as in other states. There are probably a number of things that contribute to this, but two reasons that I want to highlight is coverage can still, I'm sorry? Coverage can still result in debt. So a lot of the plans that count as covered are still high deductible plans. They either have a large deductible that needs to be exhausted first, or some plans have high coinsurance rates where even if the deductible isn't as high, the cost that's paid for each service won't be sufficient. So these plans can still exceed the savings that people have for healthcare, even if they have insurance. And then the second reason I think is most relevant to our conversation today, people are unaware of the protections against medical billing, and providers often don't adhere to the protections. So even if there are situations where bills shouldn't be going out to patients, they do. And unless someone knows that they can make a call or stop that, it still results in medical debt. Can I have the next slide, please? So I have another quiz question. In 2019, people in the United States owed how much do you think in medical debt? A, B, C, or D?
Oh, this is more all over the place.
Yeah. Oh, I'm seeing lots of different ones. This one is actually A, 195 billion. I think that speaks to the magnitude of this problem and also how very common it is to have medical debt. This is why I think it's really important that people have some tools themselves to know how to deal with bills and try to at least try one step if you think that you shouldn't have a medical bill. By person, the amount of medical debt actually varies quite considerably. The average debt is between 2 and 300. I'm sorry, 2 and 3,000. But there's a note here. You can see a lot of people owe over $10,000, and you know the numbers of people that have high debt get smaller. But some people have very significant medical debt related to complex care that just wasn't covered at all. All right, next slide. I do have at least one positive note about medical debt. So COVID relief funding has had some positive impact on medical debt numbers. Specifically, medical debt reported to credit reporting agencies has dropped. It's tricky to get clear data about all of the medical debt that exists in the country, and what makes it to credit reports is just a portion of it. It's not necessarily clear that there's less debt. It might just be it's getting reported less frequently, but it is a good sign that that's dropped. However, there is still a significant proportion of medical debt in collections and on its way to credit reporting. So my next question is, true or false? Do you think healthcare debt is still the most common type of debt in collections? I see trues. Yep. Again, not a very tricky question. This is why we're here today. It is the most common type of debt reported by the collections industry. Not only is it the most common type to have debts that collectors are working to collect on, it is also the largest portion of debt. So the amount of money in question that they're working on is also largest. It's almost double the outstanding balances owed to banking and financial services. So that includes credit cards. It's really a significant problem. So why is this? There are a bunch of reasons, but I want to highlight a couple. So the cost of healthcare is increasing. Between the 80s and the early 2000s, cancer care doubled in cost. Since the 70s, healthcare spending has increased 8 times, and that's even accounting for inflation. It went from under 1/10 of the economy in the country to over 1/5. So the cost of care itself is significantly increasing, and public insurance has tried to keep up. It does cover more than it did back then, but because the costs have increased so dramatically, the burden on patients to pay for the part of the care that isn't covered by the insurers continues to grow. I also want to note one other trend. Healthcare providers are increasingly being taken over by private equity. So there's, in my opinion, been somewhat of a profit motive in the way that the healthcare system is structured, but now it's very explicit. Companies that their goal is to make money have started taking over healthcare providers, and there are increases in practices such as upcoding, and those practices result in higher medical bills. So upcoding, as an example of one of these practices, is when there are different amounts that a facility can charge for the same service. So an ER visit is priced based on the urgency and severity of the condition. If someone goes to the emergency room for a relatively minor thing, they just had to go to the emergency room because it was at night, they couldn't get an appointment with their doctor. I think we've all experienced the reason why you would choose the ER. That should cost less than if someone comes in with a truly life-threatening, significant medical condition. If people aren't looking for that, if people don't know that that's a possibility, they might receive their bill, emergency room visit costs X amount, and not know that they've actually been upcoded to a higher rate than they should have been. There are also non-financial reasons that there's so much medical debt being collected on. I think that there's a pretty strong perception among people that you have to pay your medical bills. Folks don't want to question the doctors that have provided them care, the hospitals that are helping the community. And so instead of looking at medical bills with a critical eye, we might look at for other bills. If, our credit card or grocery bill had something on it that we didn't receive, we might treat that differently than a complicated medical bill that had things on it we didn't understand. And then medical bills are also often received when a person is in recovery from treatment or still mentally processing a change in their health status or a family member's health status. And so it's not something that you would choose to do and be ready to deal with. All right, can we move on to the next slide? I want to also highlight that the problem is not just the financial piece. It's not just debt increasing, but medical debt and the fear of medical debt also affects people's decisions and their ability to seek medical care. So many people postpone care due to the fear of additional medical debt. What percentage do you all think of people in this country postpone care for themselves or a family member for financial reasons? Got A 1/4, B 1/3, C 1/2, D 2/3. Ooh, lots of guesses here across the board. It's actually D 2/3. I was surprised when I learned that number. I feel like I kind of have a sense that maybe people are a little reluctant to get care, worried that, oh, this is going to be a really expensive bill. But I didn't realize that it was, almost 70% of people delay care because they're worried about the bills or already dealing with bills. And the problem isn't just folks self-selecting out of care, but actually 14% of people surveyed said that they had been just directly denied care. So they already had debt with a hospital or with a physician's office, and they were told, you need to clear that up before you can have an appointment. So this is one of the reasons that medical debt is such a strong focus for HLA. We really see it as a barrier to care. It's more than just a financial issue. And it is my hope that sharing this knowledge and getting some tools in people's hands about how to protect yourself from medical billing will help people seek the care that they need. So it's a big problem, affects a lot of people. Let's move on to what can be done about it. Can I have the next slide? So strategies you can use before you receive medical care. There are 3 main buckets, I would say, for these strategies. One are insurance-related strategies, one is provider strategies, and then also seeking affordable options. So first, for insurance, you want to verify your plan. Make sure that you have an adequate health insurance plan. I don't know if any local folks saw the recent Globe article. There was someone who wasn't covered for hospital bills. There was a story about them because they'd gotten this kind of not well-known health insurance plan that just didn't cover hospitals. So make sure if you have an individual plan rather than a plan through insurance, that it's on the Health Connector or your state's marketplace. Plans that are purchased elsewhere might not meet minimum requirements for coverage and might be actually missing quite essential basic things like emergency hospital care. And then even if you do have an adequate plan, and I think most people do, make sure you check the plan's coverage and network before your medical visit. If you know what you're going to the doctor for, if you know where you're planning to go, make sure that service is covered and make sure you follow any pre-approval requirements and make sure that your providers are in network. I'm going to pause for a second. I'm seeing some questions. Okay, yes, a copy of my presentation will come out, and insurance can cap the out-of-pocket ER charges, but doesn't necessarily. These high deductible plans, it can just all go to your deductible. So I recognize that checking your insurance to make sure your service and your provider are covered is much easier said than done. You can check the plan documents. I don't know if anyone here has ever read their full documents. Whenever I get new insurance, I get a huge packet, 100 pages with all the details and fine print about what's covered and what's not. It should all be in there. But you can also always just call your insurance directly and ask for guidance on these questions. You can ask them if there's any pre-approval process or if you need to do anything. Give them the provider's name. Make sure that that they're agreeing to cover. For Mass Health members, if that's relevant for anyone on the call specifically, it's important to make sure you select a managed care plan that approves the provider that you are interested in seeing. There are different managed care plans, and just like private insurance, and if once you're in a plan, you have to wait until something happens to switch, even if you have Mass Health, which should cover most providers statewide under some managed care plan. In addition to checking the plan documentation, making sure that you verify as best you can in advance, I also recommend setting up the member portal through your insurance. This is in addition to the doctor's portal. Most insurance companies now have a way you can set up a username and a password, and that is just an accessible place to start looking for your insurance claims after you go to the doctor. Information that's really relevant will start being populated there. If you can set that up in advance, it's helpful. After you look at the insurance related prevention strategies, there's also provider focused strategies. So make sure you share all of your insurance with your providers. And I don't think you should use any judgment about what insurance is going to cover your care. If you have Medicare and Medicaid or private insurance or any combination, let them know about everything. Even if your care is related to maybe an injury at work or a car accident, and so there's a workers' compensation plan or auto insurance that might cover it, just share all the insurance. There's not harm that can come from that. And then if they say, oh, well, the auto insurance ran out, or oh, this coverage ran out, then no timelines are missed on your end in getting them information about the other coverage that you have. If you only have private insurance, it's also always worthwhile to ask the doctor's office if you're eligible for any public or government programs. Ask for help applying. They might not know, but they should be able to point you in the right direction. See if there's anything at a hospital or at a facility, or if they can help you get enrolled. Right now, in most states, it's on the patient. Providers have no obligation to help with this, but it is something that a lot of states are trying to work on changing the rules about, making it so hospitals and providers are required to screen patients and then wouldn't be able to bill them if they missed a screening or missed someone's eligibility. That's not the case in most places now, so still ask yourself. You can also ask for a paper copy of what your expected costs will be after insurance is billed. If the provider won't share it, you can ask what part of the services you're receiving are covered by your insurance or what they expect to be billing you directly for. If the provider can also confirm that all of the providers you'll be seeing are in your network, that's another step you can take to just make sure you're not going to be getting bills you don't expect. We'll talk a little bit more about this later. There are some protections now related to surprise billing, but because those aren't comprehensive, I would still encourage folks to be exploring these questions with their providers. And one more tip that I think is maybe a good idea in general, but has become more relevant with the No Surprises Act, is ask for copies of the paperwork that you'll be asked to sign at your first appointment. I don't know if everyone's experience here is the same as mine, but often you go into the doctor's office, they're talking to you really fast, asking you your information, putting you in the computer, and you just sign a little electronic pad, and you're not even really sure what you've just signed. They're required to have the papers that you're actually signing and should be able to give them to you in advance. One thing that you want to look out for is a potential consent to out-of-network billing. So even though there is protection against out-of-network billing when you go to an in-network facility, you can waive that protection if you if you sign that it's okay for providers to build out network rates. So just keep an eye out to know if you're being asked to sign something like that, and always ask questions or tell them that you don't want to sign if it's not something that you don't agree with. Finally, if you're asked to pay anything up front, ask if it's required or if you can be billed later. A lot of times, all you have to do is ask and they will say, oh, okay, yeah, we can bill you for that. And that gives you a little window of time to make sure it goes through insurance and not have to deal with any potential reimbursements if something is covered. So I just want to note, in addition to working with your insurance and working with your providers, there are some providers that are required to keep their services more affordable, and those typically have the same quality as other providers. These include federally qualified health centers and safety net hospitals. So if you are worried about cost, and especially if anyone is uninsured, you can try to get care in one of these locations, and that's something a Google search can tell you about. I want to highlight, someone in the chat just noted that co-payments are often an exception. Yes, so it is still common that you would need to pay something up front. It's just worth asking if there is any part that can be billed. So what about the situations when you can't prepare? All of this sounds very nice until you just wake up in the hospital after something happens. So just a reminder that you can still use some of these strategies. If you had unexpected emergency care, you're still probably going to have to sign paperwork at some point. Ask for copies of it. You can still ask if there's any programs you might be eligible for or insurance options you can be referred to. And there are more protections from the No Surprises Act related to emergency services. So even though this sounds like a lot of stuff that has to happen up front, know that there are still protections in place even in an emergency. So before we move on to really talking about the strategies that you can use after you receive medical care, I do want to acknowledge that all of these steps can add extra stress and extra time prior to getting care, when really the thing that folks are most concerned about is their health and the care that they're going to receive. It can be helpful to have someone with you that you can review questions for your provider or your insurance. I think this is something people talk about with healthcare questions, so make sure you have an advocate who can help remind you what to ask the doctor. I think the same thing applies for billing. If someone can just be there with you and help remind you, oh, you were going to ask if this will be covered. Oh, you were going to ask them if they could confirm that they are covered by your insurance. Think about who you might turn to for this kind of support, and feel free to share if you'd like. And also be in mind, you might be the support person for someone else. So I hope that some of these strategies are helpful, not just for you, but for people that you might be working with, or personal connections. It's also helpful to stay organized. So keep all your insurance cards and insurance paperwork together. You're going to want to bring it all to show them all of those cards. So keep it together for yourself. You will likely get information related to your care that can be kept right with the items that are related to paying for the care and for any insurance network information. I would also write up a list of questions. Be prepared specifically with what you want to ask, not just your doctor, but the registration person or the billing person you speak to after an appointment. Questions can be really simple. Who will be billing my insurance? Who can I expect to bill from? Will there be any providers besides whoever the name of the doctor you're seeing that will be participating in my care? Will there be a separate cost for the facility? These are all questions that you can also ask about after the fact, but it gets ahead of any potential surprises. And then keep a list of all these providers, all these facilities. If they say, yep, you'll also be hearing from this entity, or you'll also be hearing from this anesthesiologist. Make sure you keep a list of that so that you can be looking for those bills and explanations of benefits to come in. So I want to move on to aftercare and start off with just talking broadly about explanations of benefit statements, or EOBs. These are not bills. They look like bills and they come from your insurance. They usually say something like, this is not a bill on them, but in all other respects look like a bill. You want to collect these and make sure that you have one that corresponds to every type of care you got. They used to come by mail. Increasingly, they are not. So this is part of the reason that you want to have that portal set up for your insurance. If you are not receiving them by mail, periodically, maybe a couple weeks after your appointment, start checking the portal so you can make sure you're collecting them. If your care isn't covered and you found that out in advance, or you find that out on an EOB, the first strategy that I always look at is getting overall coverage. So before we get into the details about what to do with your explanation of benefit statements, make sure you keep it in mind that it is an option to try to get additional coverage. If you're in Massachusetts, Healthcare for All is a good organization to reach out to. They can see if you're eligible for Mass Health. They can see if there might be other programs that could help you pay for your care. Some of these programs do have some retroactivity. So if you had to go get unexpected care and then you're able to get enrolled in something, sometimes you can get that previous care covered. That's been a little bit more flexible because of COVID, and it's going to go back to being a little bit more restrictive, I would expect. So this is something to keep in the back of your mind to do in a timely manner. And assuming you can't get additional coverage, assuming that the insurance that you have is the insurance that you have, you want to make sure that you carefully review your explanation of benefits. Do you recognize all of the services on the document? If there are services on there that you were told that you were not told you received or would receive by your provider, but you're being told you did receive based on the explanation of benefits, call your insurance provider, let them know. Maybe the provider has accidentally put things on your bill that you didn't get. This is where you might find upcoding. If something looks suspicious or costs more than you think makes sense, you just want to make sure that it's accurate. If your explanation of benefits doesn't cover something, then there should be a reason for that denial. If it's not on your explanation of benefits, you can call and ask, I noticed that my doctor put in a claim for XYZ service. I got it. I thought it would be covered. It's not covered. What's the reason for that denial? Sometimes that call might be considered an internal appeal. It is worth clarifying. If you just want to call and ask questions, see if they will send you something updated, see if they'll send you an additional explanation, and then you can look at what they send you and determine if that was interpreted as an internal appeal. If it wasn't, and you still disagree, you have two levels of appeal typically for private insurance: an internal appeal and an external appeal. If you either made that kind of informal call and they interpreted it as an appeal, or if you just asked some questions or are concerned about a denial, they should provide you information about what the appeal process is. You want to make sure that you ask the insurance company, give them a call, ask what that is, look at the documents they send, and look back at that initial packet or any information on the online portal to follow their instructions. They are required to provide kind of clear steps and forms if that's required, contact information. And I would recommend that if you disagree with what your insurance is covering, you take the appeals as far as you can. There was a relatively recent review of transparency data that the Kaiser Family Foundation did, and they found that of more than 48 million in-network denied claims in 2021, Marketplace enrollees only appealed 90,600. And that seems like a big number, but that's an appeal rate of less than 0.2%. And they also found that of the appeals that went through, 59 of the denials were upheld. So that means 40% of people got their services paid for. So it is worth it. There are mistakes that are made, and sometimes an appeal, even just an informal one, can make a big change for your billing situation. As part of that appeal process, you can request your claim file. That's basically all the information that the insurance company used to deny coverage. So you should request that in writing. If you want it, you have access to it. It can help make your appeal stronger. If you think that they missed something or didn't take into consideration something from your provider. Just to emphasize again, you really want to make sure you look at deadlines. Once they pass, they have passed. And then the other thing that I want to highlight about explanation of benefits is that they can happen concurrently with bills. They can happen before bills, after bills. Insurance companies and hospitals and other providers have their own internal processes. In an ideal world, the provider would bill insurance, insurance would process it, give you an explanation of benefit, that would go to the hospital, that would have an allowed amount that they can bill you for. They would then bill you whatever the explanation of benefits allowed. It doesn't often happen that way. So this is part of the reason that you want to really stay organized and check one for one the bills and the EOBs to make sure that they are lining up. I want to talk about some provider-specific issues. We've been focusing a lot on insurance. Balance billing is something to look out for. When an insurance company pays for something, sometimes the provider has a list price for that is much higher than what the insurance pays. And if they turn around and then bill the patient for that additional amount, that's called balance billing. There are some state protections against that, and specifically in Massachusetts, it's usually not allowed for people that have Mass Health. So once Mass Health has paid, that's it. And if you do get a bill and that's your situation, then you can call the number on the bill, whoever sent it to you, whether it's a hospital or a third party that does their billing, and just explain you have Mass Health, they're not allowed to bill you. And then ask for them to send you a confirmation that your balance due is 0. If you think the bill is accurate, but you still can't afford to pay it, you want to start exploring some of these other options. So you can ask the biller or the provider what the financial assistance options are that are available. Nonprofit hospitals in particular need to have their financial assistance policies visible and accessible to the public. Usually eligibility is based on income. You want to explore that, ask for a copy of the application, make sure you get that submitted, make sure it's processed. Again, there are timelines that you need to follow, so be aware of those. And then in the event that you are not eligible for financial assistance, or it's a provider that doesn't have financial assistance and isn't required to, you can always ask, you can always negotiate, say, hey, this is a lot of money for me. Is there any way that I can get a discount? Have you already applied the self-pay discount? Typically, hospitals have a number that they charge people who are uninsured. And if you have insurance, but a portion of your care isn't paid for, you can ask if they can apply that to the part that they're billing you for. And if you've tried all of these things, you can still also ask for a payment plan. Just make sure that you don't agree to a payment plan that you can't afford. And then ask for a copy of what they've agreed to in writing. I've heard of situations where there was a phone conversation perhaps about a payment plan, but then the bills keep coming for a higher amount. If you do work out a payment plan, make sure you stick with the agreed plan. All right, I want to make sure we talk a little bit about kind of how to deal with these bills emotionally as well as practically. It can be stressful, but really you should open the mail. Know that you're going to get a ton of envelopes and it's probably going to be the same bill 4 times plus the explanation of benefits. So it's not necessarily 4 bills. If you open it, keep seeing them, you see the same number showing up, it can start to relieve some of that anxiety. Know that you do have some time to pay bills. Typically, they will give you at least 120 days before anything goes to collections or any additional action is taken. But I would really recommend making a calendar. So once bills start to arrive, maybe pick a day within 30 days. Say that's going to be the day that you're going to sit down, look at everything, compare explanation of benefit statements to bills, decide what looks accurate, what you'll pay right then, what you're going to call your insurance or your doctor about, and then really follow through on those steps on that day. Maybe even if you have a support person that helped you in the initial visit, maybe they can give them this date too. They can help you and sit down together and just try to, at that point in time, reconcile everything that you have. I think that this strategy helps because there's so much stress when you're trying to recover or when you're dealing with becoming a caregiver for a family member. And if you know in advance this is the day that you have to deal with the pile of papers, then it can become something that doesn't cause the longer term stress. I also wanted to note that sometimes you do get bills that just have a total amount on them. In addition to the explanation benefits from your insurance, you should be able to get an itemized bill from your provider. So that's something that you can always ask for if it would help with making that comparison. I'm going to try to quickly go through the next slide if we can move to that. We've talked a little bit about unexpected bills. I want to highlight that this is the typical thing that happens. People go to one provider and there's a lot of other folks involved in the care. So bills that you didn't necessarily know would be showing up do. There are protections now, especially if you went to an in-network facility. But the biggest protection, or it's not really a protection, but the biggest thing I like to draw people's attention to is you would still get an explanation of benefits for surprise bills. So maybe you weren't thinking you were going to get a bill, but you shouldn't get bills that don't correspond to an explanation of benefits. That might indicate that a provider hasn't even tried to work with your insurance, which you would want to bring to their attention and ask them to send in a claim and get back to you after insurance has paid. Once bills are in collections, I encourage folks, if you are in disagreement with the bill, if you don't think you owe it, if insurance is paying, if you're in an appeals process, basically if there's any possible reason that that amount might be wrong, contact the collections company if you can within 30 days and ask them to send you the validation documents. You want to make sure that they truly have your debt and that they are the appropriate person to be seeking payment on it. You can also ask that they stop collection activity. That's just one less thing that you need to be dealing with. There are protections against aggressive collection and billing practices for medical debt, just like there are for any other types of debt, and that would apply, even though people generally think about those protections as being associated with credit cards or other financial services. If you're working on an appeal, let the debt collector know that. You are entitled to a free copy of your credit report each year. And currently, I believe, unless it's changed, you are entitled to one weekly because of the loosened restrictions because of COVID. I hope people are doing this already, but if you have gotten a bunch of medical bills, this is certainly something you want to do right after you've tried to resolve them, and then a few times after that, just to make sure that things are not showing up on your credit report. If you do see something from a medical bill on your credit report, I would encourage you to check with the current rules about what can be reported and if there are any restrictions on it. This is something that's has a lot of advocacy going on right now, and I want to make sure that you would look up what would be most appropriate to ask them to remove. And last thing before I open this up for questions is you shouldn't be billed for someone else's care unless they are your minor child. If you get billed for someone else's care, especially by a nursing home, that's something that you probably want to call an attorney about or see if you can get some help with. It's something that didn't typically happen as frequently in the past, but we've really seen an uptick in that and want to make sure that people are protected. We can move to the next slide. HLA does help people with insurance appeals, surprise billing issues, balance billing issues, and aggressive collection. Our eligibility requirements are you must be at 300% of the federal poverty level or below, but we do take medical debt into account. So if you have 6 figures of medical debt or even 5 figures, that's going to alter your income with respect to our eligibility requirements. There's our contact information, and we still have a moment, I think, if there are questions that folks have now, or if someone has been keeping a better eye than me on the chat and would like to highlight some priority questions.
I think that would be me. Thank you so much, Catherine, for all that information. Does HLA also include working with dental insurance and dental debt? Is it all the same? Is there something that would be different?
That is the same. So medical debt is defined pretty broadly here. It's not just hospitals. We do work with folks with dental billing issues, and those are excluded from some of the surprise billing legislation that has passed, as well as ambulances, as well as nursing homes, anything related to care.
Okay, well, that's good to know. Someone was asking, someone who lives out of state was asking, how do they get an attorney for someone who has large medical debt? And this is out of state. So where would you suggest they look?
Yeah, so it's tricky. And this is part of the reason that I really like to provide a comprehensive amount of information is there are not a lot of people that specialize in medical debt. I would recommend first going to the local legal services and see if you are eligible for with their income restrictions, and if not, see if they can give you a referral. That's my starting point when I'm trying to find someone in a different state that does this work. But it is challenging because often the amount of money in question from the medical debt is enough that it's a real barrier for the family, but not enough that it's something that a private attorney might want to take on.
And we have a question here. Will providers change coding if challenged? Do you know how often that happens? Can that happen?
So I don't know how often that happens actually, but it is something that they will change. If you contact them, you can always try just to say, hey, I think this is a mistake. And a lot of times things will get changed. I think the medical billing systems are set up so that it's just a fast processing plant. And if you just flag, oh, I'm looking at this, I don't think this is right, sometimes changes can be made quickly. It also can be disputed at a higher level because it's kind of an unfair billing practice. It's a deceptive thing to do. It would be the same as if you went and bought something at the store and were told it would cost X amount of money and then saw a much bigger amount leave your credit card bill. You would have the same protections. Yeah.
Okay, great. And you talk about getting the bills and multiple bills and copies and asking for printouts. Do you have a very practical suggestion? My desk kind of looked like the picture that we have that when we advertise this talk, right? The big pile, and you said people should go through it. Do you have a suggestion for ways to file it and keep that in a way that's manageable?
Yeah, it requires you to open things timely and just kind of keep track of it, because once it's a big pile, it gets really tricky. But I try to keep the first bill so that I know when I first receive something, and then I try to keep the most recent bill. The bills should say this is your third notice, this is your 120-day notice, and a lot of it's just going to be duplicates. So you want to keep the first and most recent bill, and then the corresponding explanation of benefits, and then any documentation that you might have that you either sent in or that you requested from them if you're disputing something in particular. Copies, not necessary. There's also always a lot of information about your rights. Make sure you keep one copy so that you have this insurance company's appeal process or this provider's financial assistance number. Keep one copy of that, but try to minimize the duplication. I think makes it feel much less overwhelming.
Okay, great. Somebody here had an accident, and when they wanted a receipt for the ER charge, they were told your check is your receipt, and they want to know if that was legal. So in other words, they weren't given a copy of the charge.
Oh, that's interesting. I am not sure if that would be something. I have never experienced that before. I wouldn't know if that's something that you could challenge directly, but it surprises me, and I would encourage that person to follow up, call the billing office and say, you know, I paid this. I really want to know exactly what this is for. Will you please send me the itemization of what that bill was for and how my money's been applied? They should provide that.
Okay, so I think we're coming to the end of our questions. I'm sure people have specific questions, so can they contact you, and could you put your email in the chat for us right now, Catherine, and we will send it with the follow-up information. And I want to let everybody know you will get a copy of this recording, and you will get the slides, so you can even page through them if you prefer to do it that way, and give you all kinds of thank you. It's in the chat now for everybody, and we will send that also in our follow-up email. So thank you so much, Catherine. This is really important and very helpful, and certainly gives us a lot of information that we have now feel a little more less alone, a little more protected. I also want to thank Kendra Mrozek, our administrative coordinator, who got all the technology and the slides working today. And I also want to thank our co-sponsor, 50 Plus Job Seekers in Massachusetts statewide networking groups, for partnering with us on this program. And I want to thank all of you for participating and your comments. Feel free to let us know in the chat what you learned today, what you might do differently, what step you might take next. I hope you feel a little more empowered and less alone. And I also want to encourage you to look at our website. Please take advantage of, we have a lot of resources and information about other topics. And also we have a slew of upcoming events that are listed there, as well as our partners events. Next week, we're going to talk about caregiving, which could be very much related. You could be caregiving for someone and trying to help them with their medical bills. So feel free to come to that. We have information on job hunting coming up, including our famous age-friendly employer panel. And we also have a program coming up on how to create the next meaningful chapter in your life. So please join us again. Thank you so much for attending, and have a wonderful day.
Thank you all.